Okay, let's dive right into this because today we are looking at something incredibly fast paced happening in the world of government healthcare procurement. Welcome to the Explainer. If you follow state level health initiatives, you know the drill. Things usually move at a total glacial pace, right? But West Virginia? They have just completely flipped the script with their Rural Health Transformation Program, or RHTP. They've got a massive active pipeline right now, and they are moving with absolute breakneck speed. We are talking about $55.4 million. Just let that number sink in for a second. 55.4 million. That is the sheer scale of the funding currently sitting on the table in this single active pipeline. But honestly, it's not just the mountain of cash that's staggering here. It's how wildly fast the state is demanding the healthcare market respond to it. Now, what's really interesting about this breakdown is over in that rightmost column. This is the state's entire active pipeline as of their July 15 update. You're looking at all 9 open opportunities across the board. You've got the Connected Care Grid, Health to Prosperity, the Personal Health Accelerator, and the Mountain State Care Force. But scan down that window column. You see a 33-day window for the data spine, a 26-day window for nutrition, but then look at the rest, 14 days, 14 days, 14 days, over and over again. Part 1, the 14-day procurement sprint. And that brings us to the central mystery of this whole pipeline. I mean, we're looking at blisteringly fast turnaround times to secure literally millions in state funding. You kind of have to ask yourself, is a 14-day application window just a coincidence? Did a procurement officer just casually pick a date 2 weeks out a few times in a row? In government contracting, a standard request for proposal usually sits open for a month, maybe 2, just to give complex organizations time to, partner up and build budgets. So is this just a fluke? Well, looking at the source material, the answer is a resounding no. 14 days is absolutely not a rounding artifact. It appears exactly 6 times in this active pipeline. It is always running from release date to the exact same weekday, exactly 2 weeks later. This is a highly deliberate, engineered strategy. Let's zoom out for a second and see how this builds across the whole ecosystem. Because this 14-day policy spans 3 completely different initiative families and crosses 4 different program offices. So somebody at the state level intentionally set this as the standard. They're using this aggressive timeline to force vendors to mobilize immediately. There's no time for theoretical, purely academic pilots here. The state mandates rapid operational deployment. They demand milestone-based outcomes, meaning you only get paid when you actually deliver, and they require absolute integration with a central state data spine. You basically have to be ready to run on day 1. Part 2, building the connected grid. So, what exactly are they buying in such a massive hurry? Let's look at the first major initiative, family, the Connected Care Grid. This is West Virginia's strategy to solve geographic isolation in a heavily mountainous state where broadband and transportation are just huge barriers. If we break down the funding for this pillar, you can clearly see the priorities. Out of a roughly $17.5 million pool for these 3 grants, 51%, that's $8.9 million, is going strictly toward equipping hub and spoke mobile units. Another 35%, or $6.2 million, is for the hub and spoke care delivery model itself. And 14%, $2.4 million, is to bring providers online with telehealth upgrades. The big goal here is bringing care directly to the patients, both physically with mobile units and digitally through telehealth, all while plugging into that massive data spine enterprise architecture we saw on the master table. To really grasp how they're trying to change the map, look at this quote straight from the Hub and Spoke announcement of funding availability. It says, spokes should only be in communities that currently do not have adequate physical access to healthcare services. So they aren't just funding traditional clinics here. The sources explicitly state they want these telehealth access points in schools, libraries, employer campuses, and community centers. They are literally bypassing the lack of broadband in people's homes by wiring up the community centers that people already visit anyway. Part 3. Restoring the workforce. Now, this is where West Virginia's totally unique demographic challenge comes into play. They actually have the lowest labor force participation rate in the entire country, and the #1 reason residents cite for not working is poor health or disability. So, they're using healthcare as an economic tool to fix that workforce dropout rate. They're running 2 distinct dual-track return-to-work opportunities simultaneously right now. On one side, you've got an $8.5 million grant targeting chronic conditions, things like diabetes, cardiovascular disease, obesity. And on the other side, a $2 million grant targeting substance use disorder, specifically opioid, alcohol, and stimulant use. Both of these require vendors to deploy field-based liaisons or peer recovery support specialists directly to employers to help workers maintain their jobs or get back to work safely. The source documents make it super clear applicants absolutely must distinguish between these target populations, even though both grants share that intense 14 to 20-day sprint timeline.
Part 4, Nutrition, Referrals, and Staffing.
That brings us to the remaining pillars, the Personal Health Accelerator and the Mountain State Care Force. And this brilliantly illustrates the state's whole philosophical shift in healthcare. Look at the split here. Out of the $55.4 million in the active pipeline, a single grant for nutrition and lifestyle accounts for $24.1 million. That is nearly half of the entire available pie. It proves a massive, undeniable focus on upstream root cause health interventions. They are prioritizing metabolic health and food as medicine programs to prevent chronic disease before it even starts, rather than just paying to treat it downstream. It's a real game changer.
Rounding out the rest of the pipeline, we've got a $1.5 million grant to operate a closed-loop referral system, which basically ensures that when doctors prescribe these nutrition and wellness programs, patients actually follow through. Plus, there's a $1.8 million Mountain State Care Force grant to create rotational staffing pools. This deploys West Virginia licensed clinicians dynamically across rural settings where they're needed the most. And again, repeating the golden rule of this entire transformation, every single one of these vendors, no matter the program, faces mandatory integration with the state data spine.
Part 5. Navigating the rapid windows.
So, the crucial point is this. With millions of dollars literally flying out the door in 2-week increments, what are the actionable takeaways for healthcare innovators, vendors, and grant writers staring down these incredibly tight deadlines? Well, to survive a 14-day procurement sprint, you have to know exactly what the state wants before you even start writing. Step 1, your proposal must align with Make America Healthy Again, or MAHA principles. The source documents repeatedly stress focusing on root cause prevention and metabolic health over episodic care. Step 2, operational data readiness. You absolutely must be prepared to connect to the West Virginia Health Information Network, the WV Hidden Data Spine. If you can't share data, you can't play, period. And step 3, abandon traditional upfront grant funding models. You've got to prepare your budgets for milestone-based, performance-driven reimbursements. You have to prove you can hit workforce and health metrics to actually unlock your funding. We've seen a state intentionally engineer a high-pressure environment to force rapid, accountable innovation. If West Virginia can successfully procure $55.4 million of foundational healthcare transformation in rolling 14-day sprints, it raises a massive question for the rest of the market. Will the rest of the country look at this model and be forced to speed up? It's a fascinating experiment in government efficiency, and it's one we will for sure be keeping our eyes on. Thanks for joining me for this explainer, and keep learning.